Well, hi there, good afternoon. Thanks again for joining us for today's Daily Update. I'm Dougal Saunders, joined today by Scott McLaughlin, who's the Chief Executive of the Western New South Wales Local Health District. A fairly quick update today. Some reasonably positive news again for large parts of the area, but we still do have 9 new cases to report up until 8 o'clock last night. 4 of those in Dubbo, 3 new cases at Wellington today to report, and Walgett with 2 new cases. So the health district total now is a cumulative total over the periods 1,089 and Dubbo up to 778. For the far west, Broken Hill has 3 new cases. Unfortunately, there is one more death to note today, and Scott will provide some more details, but our sincere thoughts and condolences with the family and all friends involved in that. Now, from the 9 new cases today, 2 we know have definitely been infectious in the community. That's in Dubbo and Wellington. 3 have been isolating and 4 are still being investigated at this particular point in time. 215 people are now part of that COVID community in the care program. So again, numbers dropping daily. 37 extra people were discharged in the past 24 hours and the total is now over 800 for that program, which is fantastic. Testing, around about 2,800 across the entire region, 995, so nearly 1,000 of those in Dubbo. So we're still looking for a bit more testing in other parts of the region. And a reminder that from today, across the entire Western New South Wales Local Health District, surveillance testing is available and appropriate. Surveillance testing means you can go and get a test without needing to isolate, unless you've got symptoms or you're a contact of somebody that has had a positive case or is symptomatic. I mean, you need to be sensible about that. But what it does mean is you can go and get a test, you can continue on to work, doing that work sensibly, obviously, but it's a really good way of making sure that we keep just slightly ahead of the game, which is where we do want to be as we head towards that 70% double vaxxed rate. So surveillance testing available everywhere, really encouraging you to make sure you're taking that option and actually doing the right thing as far as that goes. Vaccination, second dose clinics happening around the region. Yesterday, 1,600 vaccinations went into arms, which is fantastic in those second dose clinics. And look, the total now that's been delivered by the ADF clinics alone is over 40,000 first and second doses. Most of them, about 30,000 I guess so far, have been first doses. We're up to about 10 or so in second doses. So fantastic job from the ADF clinics that have been happening right around the region. So Nyngan continues today at the showground, Lightning Ridge happening today and tomorrow at the Indoor Sports Centre. Canowindra today at the showground as well, and Dunedoo starts tomorrow, as does Eugowra, so be aware of those venues. Mudgee still running right through until Friday at St Matt's, and Goulgong, it's the final day today of second doses, and that's happening at the Memorial Hall. Now, West Haven Clinic is still taking walk-ins. It's got the clinic running today and tomorrow at Hawthorn Street at the West Haven facility there, open to everyone. It's a Pfizer clinic. Please take advantage of that. If you haven't yet had a first or second dose, this is a great opportunity for a provider that's doing a really wonderful job in servicing its clients and all disability workers, essential workers, anyone and everyone is welcome at West Haven, open until 4 o'clock this afternoon. And don't forget your GPs, your pharmacists. We've talked about this for a long time. There are lots of booking availabilities. There's the main Vax hubs in all parts of our region. There's the drive-through in Dubbo, and then there's all your GP clinics and pharmacies. So please do look out for that vaccination opportunity. I mentioned yesterday some really good figures for some of our towns across the whole health district. We've updated overnight with some of the western towns and the northwestern towns. Scott will talk a bit more about this, and there are some areas of concern, to be perfectly frank, which you mentioned yesterday, but I just wanted to call out a couple that are doing things really, really well, and that's Burke, 84% first dose and 65% second dose. Massive job, well done. And Canamble is really setting the world on fire, 89% first dose, 69% second dose. So massive thumbs up to Canamble. That's been a huge effort. Congratulations on that. And look, places like Warren, 90% first dose, 62 second. We've seen a great result at Gill as well, 92.9 first, 57 second. So there's lots of places in our region that are getting that first and getting the second, most importantly. And Scott will talk a bit more about that. I also just wanted to quickly talk about some of the questions I've had around getting your vaccination proof. And as more and more people get their double vaccination, more and more of us are wanting to make sure we've got the proof of that. So, look, there's a couple of different ways you can do it in a digital format. And the easiest way at the moment is if you can download the Medicare Express app. I literally did it myself the other day, with a bit of help from my wife, but that's very available, very easy on your smartphone. You just go to the App Store, whatever sort of phone you're using, if it's a smartphone, download that app, and that then provides that proof in the Medicare Express app. You can also go through the Australian Immunisation Register, which can provide that full immunisation history. It can do a statement, either digitally or a printed statement. If you can't do it digitally and you do want it printed, it's pretty simple. You can order that online, or you can ring up and order it. Now, do be aware, if you are after a printed copy, it may take in some cases up to 14 days. Hopefully not that long, but that is the time frame they're putting up. And if you need to call them, we've got a number that's on the Facebook post as well, but I'll give you that. It's 1800 653 809. That's Monday to Friday, 8 until 5. All the links, all of that information is on this post. Make sure you open the post, click on the little bit at the top that says see more, and that'll provide the detail that you can get the number and all of those links from. And look, just to finish up, Service New South Wales is still working on its app, which will bring all of those things together and have it in your Service New South Wales app as it currently stands. And that's the one you can sign into at any venue. That's not ready yet. It is still being worked on. Things are actually possibly moving a bit quicker than expected, but as soon as it is available, well, it will be there for you to use. In the meantime, Medicare Express app is a great way to go, or order your printed copy. There are obviously a number of local government areas that we've talked about that are looking at coming out of stay-at-home orders from today. The decision will be made, and that won't be made until a bit later on this afternoon, but we'll know the result and that will be announced tomorrow morning. So just a reminder, we are aware there are a lot of people waiting for that information. We'll let you know as soon as we can. It includes Orange, Gill, Narromine and also Bree. So we'll keep fingers crossed, and I know a lot of people are waiting for that information. Thank you. I'll put Scott forward now, and he can give a bit of an update as well.
Thanks, Dougal, and good afternoon, everybody. Tragically, we've been notified of another death with a person with COVID-19. It was a woman in her 90s at St Mary's Villa in Dubbo that had a lot of underlying health issues. She was fully vaccinated, but sadly passed away in the last couple of days. Now, this will be updated in tomorrow's numbers, but can I pass my sincere thoughts and condolences on to the family, to the friends, and all of the team and people at St Mary's Villa. I know it's a very sad day. Dougal mentioned that lower case numbers in the last 24 hours, and while that's still pleasing to see that we've got some plateauing of the numbers, that there's still some real risk in our region of further spread in some communities. Certainly higher risk with new active cases in the last 24 hours in the community. Vaccination is still booming, so thank you to everyone that's getting vaccinated at the moment. That there's a lot of opportunity around our region right now to get vaccinated, and particularly with second doses. I'll talk in a minute a bit more about some of the locations that we'd love to see higher rates of second doses in the next week and 2 weeks. They'll be crucial for us hitting that 70% mark. So 9 cases to 8 p.m. yesterday, with 4 in Dubbo, 3 in Wellington. Out of those 3 in Wellington, 2 are household contacts and 1 still under investigation, and 2 in Walgett. Both of those are household contacts. Now, yesterday there was 1 case identified in Walgett. That's now been known that that person is actually in Sydney, and so that will be taken off the list from yesterday. Out of the total 9 cases, 4 have got known links to other cases, 2 in household contacts and 2 links to other clusters or cases. We've still got, however, 5 under investigation and more information being sought. Definitely 2 out of those were infectious in the community, and so again, a real warning for us right across the whole of the region. There are people with COVID in our communities, in our shopping centres, supermarkets, service stations, in our homes and over the neighbours' fences. So please, everyone, still maintain your vigilance around everything that's kept us safe up until now and starting to head us in the right direction. There's a case that's been recorded in Mudgee in the last 48 hours that was infectious in the community, and further details will be updated in the next 24 hours on the locations of those. To the couple of aged care facilities where we've seen outbreaks in the last couple of weeks, there's some improving news, whilst there's no doubt been some real sorrow with the passing in the last 24 hours. We've now gone for more than a week in both of the facilities in Dubbo without a new case being identified, and quite a few of the aged residents have now come out of their 14 days or their period of having COVID as their main infection. So there's some pleasing signs there with now 10 residents who are still in care at St Mary's and just 4 residents in Holy Spirit Aged Care in Dubbo. Likewise, in the Opal Aged Care Facility in Mudgee, there hasn't been any new cases identified in that aged care facility, either in staff or residents, and there hasn't been any cases identified in residents in the last 2 or 3 days, with increased testing happening for all of those residents. Now, more testing is happening today, and so we'll continue to update, but there's some pleasing signs there. There's new venues of concern that have been loaded in the last 24 hours across Cowra, Dubbo and Wellington, so I can urge everyone in those communities or people who have been in those communities to have a look at the New South Wales Health website. Make sure you regularly familiarise yourself with those venues of concern. Let your family, friends and other people know if you think that they may have been in some of those venues of concern. To sewage testing, we've seen a new location identified overnight in Oberon. Now, this is a location where we don't have active cases, and we know that there's been a lot of connection with Oberon and Sydney and other people travelling through the region. That's particularly of concern, and so can I urge everyone to come out and get tested in Oberon at Albion Street today between 11 a.m. and 4 p.m, and right throughout the rest of the week, Thursday and Friday, 10 a.m. to 4 p.m. If you can please, if you've got any signs and symptoms, don't leave home without coming and getting tested. But equally, if you don't have any symptoms, please come and get tested. You don't need to isolate unless you've got someone in the household that does have symptoms, or you've got a connection or been identified as a close contact. So there's some concerning news there that we've got a new location. Typically, where we have seen the sewage detections go off, we have found cases in the coming days, and so please, everyone in Oberon, stay very vigilant. Yesterday's tests around 2,800, still lower than what we'd like to see, but today we've got the new opportunity for everyone. Please start to come and get tested right across the whole of Western New South Wales, even if you don't have symptoms. I'll say again, if you don't have symptoms, you don't need to isolate. You do need to isolate, though, if you've got someone in the household that has symptoms or you're identified as a close contact of another location. So surveillance testing will continue over coming weeks. Please, everyone, this is our time to get in front of COVID in Western New South Wales. The mobile at-home testing continues across Dubbo, Orange, Bathurst and now Cowra. Please, if you do need to be tested in your home, call ahead to the number 1300 066 055. Our teams do have capacity to come and visit you. Again, a further decrease in the numbers of patients in our Care in the Community program, or people with active COVID cases in our communities, to 215. A further 37 discharged in the last 24 hours. And so with the decreasing case numbers being identified every day in the region and more people being discharged, there's more people recovering from their COVID infections. Again, a further decrease of the numbers of patients in hospitals to 15 across the whole of the region, 7 in Dubbo, 6 in Bathurst, 1 in Orange and 1 in Narromine, with out of those 15, 5 in intensive care and 4 of those ventilated and quite ill. Around 9 staff are now in isolation across the region, still very low numbers, and so a lot of staff have returned to our workforce in recent days. Just back to vaccination. Second dose is the absolute priority for us to get to the magical 70 and 80%, but for me, to get the maximum protection for you, your families and everyone around you. We know that there's a lot of opportunities will come with getting the double doses of both Pfizer and AstraZeneca, but now also Moderna, which is starting to roll out in pharmacies in the vast majority of towns right across Western New South Wales. So please look for those opportunities. The best opportunities in a couple of towns are coming up this week with Gulgong, Nyngan, Canowindra, Dunedoo and Cowra, all with the Australian Defence Force in towns, and particularly in Cowra, if I can ask everyone to look for those opportunities both for first and second doses. You will have been notified if you've got a second dose coming up to attend those clinics, but please, if you're keen to get a first dose, please attend those opportunities. To a couple of the figures that Dougal talked about, there's some very pleasing increases in vaccination rates for a couple of our communities. So for the Bogan Shire Council or Nyngan community, 78% first dose. Really worryingly though, second dose rates are down at 28% for Nyngan and the Bogan Shire. So please everyone look out for those opportunities. The ADF team is in Nyngan this week for second dosing, but safe to say that's not going to be enough to do everyone to get us up to the magical 70%. And so please, everyone that's needing to get a second dose, please make sure you've got a booking with either the practice in Nyngan or the pharmacy, both doing vaccination in town. As Dougal mentioned, 84% for Burke first doses and 65% second dose. Brewarrina, 72% first dose and 50% second dose. In Cobar, again, a bit of a concern here, 66% first dose and 28% second doses. Again, the ADF team is in Cobar this week doing second doses, but can I ask everyone to please look for opportunities for those second doses. And the record setter in the whole of the region, I think the state is Canamble at 89% first dose and a whopping 69% second doses, nearly at the 70%. And Walgett with 79% first dose and 53% second dose. Now, just to run through a couple of those figures was helpful. I know there's a lot of figures floating around, but it's not about the numbers. It's about protecting every person in all of our communities. We know that COVID will continue to spread through our community in coming weeks, months and years. The best protection we do have is the vaccinations that are available, and the best vaccine is the one that's available today. And so please don't hesitate in looking for your first and second dose. Listen, I might pause now and just hand back to Dougal to see if there's any questions for Dougal.
Thanks, Scott. Thanks, Dougal. If anyone has any questions for Dougal, could you raise your hands now, please?
Off the
Just
hook.
give it another second in case anyone missed it, but...
Happy days. Thank you.
Yep, thanks, Dougal. We'll bring Scott back forward. Chris from Prime 7, do you want to kick us off?
Hey Scott, it's Chris here. Just wondering, I know we sort of touched on a bit about decision made for some areas in Central West come out of lockdown. Do you know, from a health point of view, any sort of criteria that is needed? Is that like any concerns to sort of meet that criteria?
Chris, sure. So there's, as I've talked about the last couple of days, there's a panel that meets, and it'll be meeting later on this afternoon to consider a range of conditions that weigh up the risk of COVID spread in a community and a decision around whether the lockdown will be released or not. So that'll take into account whether there's been any new cases that have been infectious in the community in the last couple of weeks, both sewage detections and the testing rates. Now those are all things that are being tried to be weighed up just to understand the level of risk for communities. Now I know that panel's meeting later on this afternoon and I'll take all of that into account.
Right, that's all from me. Thanks, Scott.
Thanks, Chris. Ollie from Wynn.
Good afternoon, Scott. How are you doing today?
G'day, Ollie. Good.
It's good. I just have a question also about criteria for these LGAs coming out of lockdown potentially, particularly Orange. I know that if you look at the testing numbers for the last fortnight, it averages out at about something like 300 a day. And, Orange has a population of 40,000 people. And it's a big regional centre. Do those numbers concern you, and how likely is it, do you think, from a health perspective, that as a regional town, a regional centre like Orange would not come out of lockdown because of those really low testing numbers?
Well, I think the testing numbers are just one of the things that need to be weighed up. I don't have a magical science or a rule of thumb of how that's going to happen. I know there's experts, public health and epidemiology experts, that will be taking all of those things into account, and I wouldn't want to have any insight into what they might come up with.
No worries. And if I could just quickly ask, do you think that that has surveillance testing really boosted testing numbers, or are we still seeing a bit of a lag?
With the start of the surveillance testing right across the whole of the region today, I'd hope we really would see some increased testing numbers, in particularly a couple of the locations where we have seen decreases in recent weeks, particularly in Orange and Bathurst, but some of our other smaller communities as well. So if I can encourage everyone, please, if you've got any signs and symptoms, don't leave the house without coming and getting tested. But if you don't have any symptoms, please, likewise, come and get tested on a regular basis. It's something that will help us figure out if we do have COVID in our communities. There's a lot of sort of surveillance things that are happening that this is just one of the extra tools in our toolkit to help us find out where COVID is in our region.
Really appreciate that. Thank you.
Thanks, Ollie. Sam from the Western Advocate.
G'day, Scott. Just two from me today. Are the plateauing cases a good sign that surveillance testing across the region is starting to have its desired effect?
Well, I think, Sam, the plateauing numbers are a result of a lot of our hard work, particularly the stay-at-home orders and people reducing movement around our community, our ability to help people get into isolation quickly if they've been diagnosed with COVID, and wrap some support around their family, their household and others around them. And so I think the plateauing numbers are all part of all of our efforts to get it under control. What was a few weeks ago a pretty worrying outbreak. The surveillance testing, however, is our response to try and figure out how we get in front of COVID spread if and when it does take off again in Western New South Wales, and to make sure we've got every tentacle out into the community to try and figure out if we've got any cases that haven't been diagnosed, or maybe people that aren't symptomatic at the moment.
Perfect. Thanks for that, Scott. The next question's a bit left field because it's kind of not really about COVID, but it is in a way. Obviously, there's been some pretty heavy situations facing a lot of healthcare workers across the district in dealing with this, and obviously there's been deaths like the one you reported today, a lot of people in ICU and in hospitals requiring urgent care. So I just thought I'd ask, how much is being done to look after the mental health of staff across the local health district?
So we've got some absolutely amazing staff that over the last month, 6 and 8 weeks have been just incredible, working a lot of long hours, and so we've put in place a lot of supports around our staff to help us understand if anyone's struggling, then we can provide that support. If we need to help people out with changing rosters and other things, those are the things that we're trying to take into account at the moment. Can I just say thank you so much to all of our 8,000 staff across Western New South Wales. You've been absolutely incredible in providing the support to our community, our patients, and particularly for stepping up to care for people with COVID, both in the homes and across our hospitals.
Thanks, Scott. That's all from me.
Thanks, Sam. Taylor from the Daily Liberal.
Hi, Scott. I don't have any at the moment, sorry.
No worries, Tay.
Thanks, Taylor. Riley from the Central Western Daily.
Hey there. So mine's, sort of somewhat about the lockdown situations as well. Obviously, you said we won't know until, likely tomorrow morning. I guess, but talking about the businesses that, will open up, if these LJs are given the go-ahead, what are some of the measures that, businesses have to take before they open up? I believe I've seen, businesses must do, a deep clean prior to opening. I guess, can you speak to that and just how important it is for these rules to be obeyed and, what the rules are, really?
Sure. I think for any business or locality coming out of the stay-at-home orders and businesses reopening, one of the most crucial things that we know is that COVID has spread within workplaces and in shops, and so it's the vast majority of our spread has been indoors. So can I urge everyone that might be running a business and thinking about the opportunities of opening up, that the most crucial consideration you need to take is what's going to keep the staff and people coming in and out of your business safe. Now, every business should have a COVID safe plan. It should go through everything from how many people you can have in the environment at the time, the entry and exit points, the things that you can put in place to have safety for people coming into the business, particularly hand hygiene, the sanitisers, QR checking codes in a really prominent place. And generally the COVID-safe plans are a really good guide that everyone should be dusting off and looking at what should be in place to keep yourself, your staff and customers safe in those environments. And I think this is one of the most crucial things for us in coming days and weeks, with more movement of people in our communities and the known spread that we've seen in businesses, to make sure that we can keep everyone safe.
Okay, no worries. And sort of a similar sort of question. I guess obviously, if these LGAs open up, people will be flocking back to work for those who can. But I guess for those who, have the capacity to still work at home, I guess how long should they be working from home for? Is there a sort of a guide about, when they should return to the office, or even if they should return to the office?
Well, I think we've all adapted to working from home for a lot of different industries and services. So for the last 15 and 18 months, I know there's been a lot of people working from home. I think it makes absolute sense. While there's still risk of COVID spread in our region, I think that can absolutely be the way that we continue for some time. So where possible, then definitely work from home. It's obviously a workplace consideration. There's some jobs that just can't be done in that environment. So people just have to take a bit of a sensible approach to it.
Yep, cheers for that.
Thanks, Riley. Molly from ABC Central West.
Hi. Firstly, in regards to Oberon, how concerned is LHD about that sewage fragment? And is there concern that it's a local, or is it someone passing through, as you kind of mentioned?
I'd say we're extremely concerned about the new sewage detection in Oberon. It's been a very high test result that's come back for Oberon. Where we've had test results go off in other locations, we've found cases within the days following, and so I'd say fair to assume there's someone in Oberon that's either had or has COVID at the moment and could be very infectious in the community. So can I urge everyone, please come forward and get tested. The testing is available today, tomorrow and Friday in Albion Street, so please don't hesitate. If you've got any signs and symptoms, don't leave your house without coming forward and getting tested. If you don't have symptoms, please again come forward and get tested. You don't need to isolate unless you've got someone in the house with symptoms or you've been identified as a close contact.
Thank you. Secondly, in regards to parks, we understand that ante and postnatal maternity services are being relocated to a council site. Will the LHD be paying for that relocation?
Guys, I don't have any details on a location in parks, but I know that the antenatal and postnatal services are just crucial for all of our pregnant mums and the families to have that support, the diagnosis and wraparound planning for their birth. So those are the crucial things that we'll be maintaining. I know there's been definite consideration of where and how that happens in parks, just don't have any details on it.
No worries, thanks.
Thanks, Molly. Andrew Fisher from ACM.
Yes, good afternoon, Scott. The two carer cases, can you tell us, are they both being treated at home, and have you been able to link the two cases?
Yes, we are treating both of the carer cases in the home, and obviously supported with the family and household in those homes. We haven't been able to identify the links for those cases yet, so again, a real warning and I guess a cause for concern in carer. We haven't identified new cases with the testing in the last couple of days that's happened. Thank you to everyone that's come forward and got tested, but it really hasn't helped us track down where those cases might have picked it up from, or who's or who they might have spread it to. And so please can I continue to urge everyone, come and get tested, particularly if you've got any signs and symptoms. Don't leave the house without coming and getting tested in carer.
Okay, thanks, Scott.
Thanks, Andrew. Gary from ABC Western Plains.
Hello. I just wanted to ask about hospitals in our patch. Given that the trend is that there will be an increase in hospitalisations across the state over and heading into October, what sort of preparations are in place to, make sure that hospitals in Western New South Wales are prepared for that spike in hospitalisations?
Sure. So, Gary, as we've talked about a number of times now, we've been preparing for the last 18 months to make sure that we can care for patients with COVID and for all of the other illnesses and viruses and diseases around our community that inflict on people. So, that's something that we're well prepared for. We know that through the last 6 and 8 weeks we've seen quite a few patients needing to be admitted to hospitals, and we've done, I think, a fantastic job of caring for those patients, and the vast majority have been able to be discharged and are now free of COVID in their homes. The bigger story, though, is the over 800 people that we've cared for in their homes with a specialist team going into the home, all of the wraparound support with additional food, the household wellbeing supplies. And so that for me has been the bigger preparation, and the thing that I think we've done a fantastic job of is providing specialist clinicians into the home on a daily basis, checking in support around those families and people with COVID, and a lot of other support where police, Australian Defence Force and others have played a significant role in helping us to keep people safe.
No worries, thank you.
Thanks, Gary. Finally, Oliver from the Canberra Times.
Hi there, Scott. Thanks for your time. I just wanted to quickly touch base based on the really impressive vaccination rates that you were listing off before. Obviously, Canberra, you said, is really approaching that 70% double dose, and then other communities around it are getting closer and closer. Was just wondering why, if there's any thoughts from yourself, why some communities have been doing so well in increasing their vaccination rates, while others are still lagging behind a bit.
Yeah, sure. It's been really impressive to see some of the communities like Canberra really stretching ahead. What's really clear is there's been some general practices, Aboriginal medical services, pharmacies and other providers in the town, as well as the local health district and ADF clinics, that have all had a rally to help vaccinate people as soon as possible. I think the community of Canberra and everyone living around Canberra has been really driven to make sure that they can get vaccinated. Now, that's not the case in every community. I think I just called out both Bogan and Cobar Shires that have got low rates of second doses. Now, we do have teams in those communities this week with the offer of second doses, but there's clearly a need for us to step up and get vaccinated with second doses in some of those communities as a real matter of urgency.
Fantastic. Thanks so much, Scott.
Thanks, Oliver, and thank you everyone for attending. That's all of them, so we'll call it a day and we'll get the recordings out as soon as we possibly can. Thanks, guys.
Thanks, everyone.